Health conditions before pregnancy. If you have an existing health condition, you may need extra care while you're pregnant. Health check. If you already have a health condition, especially if you're taking prescribed medication for it, it's a good idea to have a health check before you start trying for a baby. If you have an existing health condition, you'll be referred to an obstetrician for your pregnancy care. You may have extra appointments and extra scans too. Epilepsy. Most women with epilepsy have a straightforward pregnancy and a healthy baby. However, some common medicines for epilepsy aren't safe for pregnancy. Some women will experience increases in fits during pregnancy. Your midwife will work with both an obstetrician and the neurology team to provide your pregnancy care. Diabetes. If you have type 1 or type 2 diabetes, your blood sugar levels will need to be closely monitored and well controlled before you're pregnant and during your pregnancy. This is especially important in the early weeks of your pregnancy, as high sugar levels can cause issues with the way your baby's spine or heart develops. Diabetes increases the risk of a large baby. Birth by cesarean section, C-section. Your baby being stillborn. If you have diabetes, your baby's likely to be born between 38 and 40 weeks. Your midwife will work with an obstetrician and the diabetic team to provide your pregnancy care. They might recommend that your baby's delivered a little early. Group B streptococcus infection. Group B streptococcus, GBS, is one of many bacteria that live inside your bowel and vagina. It usually causes no harm. About 1 in 4 pregnant women in the UK carry it without any symptoms. Testing for GBS. It's not possible to know who has GBS without testing for it. Sometimes GBS is picked up when you have a test for something else, but there's no routine test because lots of women carry it without being unwell. Talk to your midwife or GP if you want to know more about being tested for GBS. You're worried about the risks for your baby, GBS, and your baby. Most women who carry GBS give birth safely to a healthy baby who won't develop the infection. There's a small chance that GBS could pass to your baby during labor. A few babies who come into contact with GBS can develop a serious infection such as pneumonia, meningitis, sepsis. If there's a high chance that GBS could pass to your baby in labor and birth, you'll be offered antibiotics during labor. Your midwife or obstetrician will talk to you about whether your baby's at higher risk and what that means. Mental health conditions. If you have or have had a mental health condition, tell your GP or midwife when you find out you're pregnant. They can check how you're doing and make sure you get the right support during and after your pregnancy. Where required, your midwife will work with both an obstetrician and the psychiatry team to provide your pregnancy care. If you take medicines for mental health, don't stop.